This is part 3 Instruments of Obs and Gynae. The instruments are pertaining to the tubal patency and general surgical instruments. This is Leach Wilkinson's cannula, the instrument used for tubal patency. You can see that this is open at both the ends and the proximal end is having screw like end, and there is a stellate inside it. Dye is injected through this and the tubal patency is tested. It is used for hysterosalpingography, for chrome perturbation in laparoscopy, and for hydrotubation and saline infusion sonography. Another instrument which can be used for the same is a pediatric Foley's catheter number 10. So here, instead of the Leach Wilkinson, the Foley's catheter is inserted. It is then inflated and made self-retaining, and the dye is then pushed. The general instruments: Cheetle forceps. It has no lock and it is a long instrument. It is used for catching hold of the drapes, swaps, instruments. This is towel clip made up of stainless steel, sterilized by autoclaving and boiling, used for draping, and this can also be used for hemostasis. This is sponge holding forceps. It is a long instrument. It has fenestrated blades at the end which is having transverse serrations, and there is a lock. Uses: it is used for painting and cleaning preoperatively the preoperative site. The swabs for cleaning and for swabbing the cavities, whether it is abdominal cavity or vagina or pelvic cavity. In gynecological surgeries, it is used for applying pressure on deep points in pelvic surgery, for checking hemostasis of the stumps during vaginal hysterectomy, for packing away the intestines or omentum in gynecological surgeries. In obstetrics, it is used for holding pregnant cervix during tightening of the os, also used for catching cervix, for detecting the cervical tear, as used in cases of the traumatic PPH, and used for swabbing out blood in the uterine cavity. This is straight artery forceps. It is long, it is small, and mosquitoes are still small, has a lock, and the end is having serrations. These are used for hemostasis, for holding structures like peritoneum, erectus sheath, vessels, for suture removal, for catching hold of the sutures when they have to be clamped and held long. Can be also used for clamping the placental membranes after birth. This is Bart Parker's handle with knife, used for giving surgical incision. Different types of the blades can be attached. The number 10 is most commonly used, and there is a angled blade 11 which is used for stab incisions for draining abscess, Bartholin abscess. This is Alice tissue holding forceps. It also is small and medium. This is around 6 inches. It has tooth on its end and it has got a lock. It has multiple uses. Used for catching hold of the rectus sheath while opening and closing the abdominal wall, to catch hold of the vaginal ends in cases of anterior colporrhaphy, enteroceal repair, colpoperineuropathy, in vaginal hysterectomy, in abdominal hysterectomy, in Fothergill's operations, then to hold the cervix in abdominal hysterectomy, to hold the lip of the pediatric cervix, to even hold the uterus in vaginal abdominal hysterectomy, myomectomy. Then in obstetrics, in the lower segment cesarean section, most of the times it is used for catching hold of the uterine incision, and even the angles, also used for correcting inversion. This is the right angle retractor, also called as a Journey's retractor. As you can see that it is having a right angle and can be used for either of the sides. Again, sterilized autoclaving or boiling, used for retracting the abdominal wall during tubal ligation, for retracting the bladder, retracting the vaginal wall during hysterectomy, retracting the abdominal wall during tubal ligation. So whenever you want to visualize properly and therefore you want to retract the structures laterally, these retractors are used. Another retractor, this is a Tubal retractor. It's a long retractor and it comes of multiple sizes. There is a set of 3 or 5, so that the depending upon the upon what how much of retraction you want, use different sizes. This is a tooth forceps, mostly used for catching hold of the tough edges during applying of the sutures, and whenever you want to pack away in the deep cavities, for holding tendons, for holding fascia, for holding skin, and even can be used for hemostasis. This is a needle holder. As you can see that the distal end is small than the formal. At the same time, the end is having serrations and there is a longitudinal groove. This is to hold the needle properly. As you can see how the needle is held at the junction of distal 2/3, distal 1/3 to anterior proximal 2/3. This is again just a glimpse of how it looks. Surgical scissors. These are study scissors, also called as a tissue scissors. The ends do not damage while separating the tissues and are used for cutting tough tissues such as rectus, fascia, parametrium, vaginal cuff. So these are the surgical scissors. Curved scissors used for dissecting in the depth and to improve the visibility. They are used for cutting adhesions, for cutting the growth, and especially vaginal cuff during hysterectomy, and to cut the pedicles at the various steps when you are doing the surgery. This is stitch removal scissors. As you can see that this is having, again, the terminal end is small. It is having 2 sharp blades, and this is used for cutting the suture, so that end of the suture is cut with an artery, and these fine scissors can help in removing the sutures. The stitch is hacked with these serrations by passing the blade beneath the stitches, and it is hooked and it is cut. The free end of the knot is held either with a tooth forceps or sometimes even an artery is used. This instrument is the metal flushing cannula. Now it can be used as a suction cannula and even as a flushing. So when you want to clean the field clean, you use a metal suction cannula. So that was all about general instruments. Thank you.